I'm Joyce from Sage Plus Clinical Pharmacy. I'm one of the clinical pharmacists here. Today I want to show you how to use one of these devices. It's called Turbuhaler. If you open it up, it'll look identical to my sample, so I'm going to start using the sample. But first I want to show you the Turbuhaler does have a counter. It looks like this. So it actually counts down how many doses you have left when you use this. Now, how do you use this, right? You don't really need to shake this or anything. And what you hear is actually just the propellant or the preservatives that's in the container. So don't worry about shaking. All you have to do is turn and you hear a click. So there you got the dose. So what you want to do is you want to exhale fully by emptying your lungs like so. And once you do that, you can seal your lips around this and suck. You don't really need to suck really hard, just a little bit. And try to hold your breath for about 10 seconds and blow it back out through your nose. So I'll show you once. Twist to open the dose. Empty your lungs. And that's it. After you use something with a steroid in your inhaler, you should always try to rinse your mouth and spit the water out to prevent yeast growth in your throat. I hope this helps how you use the Turbuhaler. If you have any questions, please give us a call or email us at info@sageplus.ca. See you again.